We've got Dr. Veronica Joe. She is she's an MD and the CEO of Avid Sports Medicine. She's a medical doctor who holds board certifications in internal medicine and sports medicine. While practicing sports medicine in the Bay Area for over 10 years, she's taken care of a complete range of patients, everyone from athletes to elite athletes, and more. As an associate team physician at UC Berkeley to underserved patients, as a sports medicine specialist in Kaiser Richmond, whatever the population, she strives to empower patients to recover through empathy, education, and partnership. So with that, go ahead and take it away.
Yes, we're ready to go.
And we're a cloud clinic that brings sports medicine to every medical office. Essentially, we're operating as a managed service organization to allow any clinic in the United States to have sports medicine as a practice in the box.
Hi, I'm Dr. Veronica Chow. I'm an internist and sports medicine physician. I primarily trained on the East Coast, but I've been practicing here in the Bay Area for 14 years. And I've been in the complete range of practice settings from underserved patients to elite athletes. And most people get the typical model, which is going around to different offices to try to figure out their problem, can take forever. Contrast that with being a team physician at UC Berkeley. It's all hands on deck, integrated solution that takes care of people, and they get better faster. My vision for Avid Sports Medicine was to bring this model to the everyday person. I've also been involved in early and late stage startups. Usually they're focused on access, convenience, and those are important, but they're not really changing the care model. So I put together this team to take our model to the masses. I opened our clinic about 4 years ago, actually exactly 4 years ago, and the vision was a one-stop shop. You get diagnosis and treatment on the same day. This really shouldn't be revolutionary, but it is in our system. I also wanted to have a range of options from physical therapy to procedures to manual-based therapy, and I put together a team of partners that we all work under the same umbrella. And probably one of the most fundamental changes I made in the care model is integrating healthcare with fitness and wellness. We're open, the vision is a reality, and we're seeing hundreds of patients. People are getting better, they're getting healthier, back to their daily lives. We see everything from ankle sprains to herniated discs. And while I love it, I realize it's really limited within these 4 walls. There's only so many people that we can change and help. So this vision that you're going to hear about is about taking this model to the millions who need it. So we call it Avid Sports, but sports medicine is not just about athletes. It's actually about any way that you move. And movement is fundamental for health. Adults, about 50% of us have some sort of musculoskeletal issue at a time, and it's costing our healthcare system a lot of money. Traditional healthcare models, they get overwhelmed by these patients. You've heard it already. Like someone comes to their doctor, their PCP with shoulder pain, they either get NSAIDs and told to wait it out, or they get referred. That process takes weeks to months. Meanwhile, they've got a chronic problem on their hand. This is costing our system. It's wasteful, and it's also poor outcomes. So the challenges I sort of already set up. A lot of patients have these problems, and when they go to their frontline practitioner, that person usually has limited sports medicine training. I know I trained as an internist. I mean, I think maybe I got a day of this kind of treatment or this kind of training. So that means there's a delay in the diagnosis and treatment, and patients get really frustrated. They end up Googling, which leads to a lot of misinformation and often makes the problem worse, as this really fragmented model leads to chronic issues. And so I started this clinic and just kind of took a leap of faith, but as we got more and more praise, I sort of looked around and thought, why are more people not doing this? Like, seems like common sense. And there are a lot of reasons. There's limited time and resources. There are a lot of costs to starting up, getting equipment, skills. Running a business is not something we learn how to do in medical school. And it really leads to a lost opportunity to take care of the patients in front of you. So I believe that every medical office should be able to offer in-house sports medicine. And if the patient that comes to you with their problem, they want to be treated by the practitioner they know and they trust. They want diagnosis and treatment on the same day, and they want a full range of options. And I think what it also sets this apart is we're not just hoping the patient gets over their acute pain. We're setting them up for long-term return activity and maintenance care. So there are a lot of apps out there. You can find them. There's a lot of physical therapy apps like Hinge, Sword, Physera. These are not filling the gaps. They're providing as part of the solution, but I believe we really need in-person and digital solutions to make real change, and that typical digital healthcare is not the answer to our problem.
So my background is in startups. I actually started out as a patient of Dr. Zhao, and I saw what she was doing here at the clinic, and I actually got better. I had been to many physical therapy places, and I was not getting the care that I needed, but I found it here. And in talking to her, I really realized that expanding this on a brick and mortar basis was probably not very effective, right? You need a lot of capital. We need to open up one clinic after another. And instead, why not take something from the business world like a franchise model, or what now they call managed service organization, MSO, and enable every single doctor's office across the United States to offer the same level of care that Dr. Zhao does here, with a combination of software and services that enable that practice to be able to offer everything that we do in sports medicine, but for a fraction of the cost and without any of the large headache of opening up this practice, which will then allow them to open up new forms of revenue in a very quick way. So what a traditional managed service organization will offer is a couple piecemeal services that put together. We've actually developed an entire package of services for any clinic in the United States that includes business and operations support, practice management software and support. We have clinical practice guidelines and training. We have the equipment, so the ultrasound equipment, the gym equipment, pharmacy and nutraceuticals. We have a telehealth platform. We have remote patient monitoring, integrated patient billing and insurance system. We offer virtual consultations. We have online fitness and training programs. And we have a highly optimized marketing platform to allow those other clinics to be able to grow their patient population specifically for musculoskeletal or sports medicine.
So as I mentioned, I've been doing this for 14 years. I get so many questions from frontline practitioners, be it nurse practitioners or primary care physicians, about how to do a good musculoskeletal exam, how to think about the patients in front of them. I believe that we can train people to do this. And with a 8 or several week course, we can create a level of competency that allows people to take care of the patients in front of them. And that should include evidence-based practice, but it should also think about today's healthcare environment. We need to be able to harness AI to make efficiency in the model. And I think one of the best things is, as we grow this model, we're going to develop a lifetime of support from all the specialists that are involved. It's going to create a place where people can go for questions, lifetime learning, and community.
Now, the real game changer here, I think, for our model is the insurance side. A lot of small independent practices do not have insurance, and especially for a new line of practice or a new modality of practice for these businesses, for these clinics, getting into insurance is very tough. So what we've done is incorporated a billing and coding team that uses AI to really understand SOAP notes, patient billing stuff, and is able to allow every single clinic to be in-network and provide in-network care to their patients, which will allow their patients to pay less and be able to get a higher level of quality of care through their insurance with less headache, which I think is a game changer for this type of business. Now, this is a big vision, right? There's a lot of things that we need to do to help enable every other practice to perform like Avid. And we're not trying to do this ourselves. So essentially what we've done is created a group of companies, a partnership of companies that is working together for this. We're using Athena Health for medical billing and coding. We have our own billing and coding team as well. TruePill for lab testing, RX management, that type of stuff. We have Precore and a couple other hardware partners for the ultrasound systems and gym equipment. Elation right now we're using for our EMR, but we're going to be working with some others specifically for the sports medicine, and then Deep Scribe, which is an AI medical scribe. So trying to take out most of the work from the doctor's offices with a partner of systems and delivering it to you in a very frictionless way.
1 minute.
So we have a growth strategy where we're going through independent clinics, multi-specialty clinics, and large. We're trying to start small and then grow from there. Our pricing model is really focused on a cost plus model. Most MSOs across the United States have a cost plus model. We'll end up taking around 7 to 15% of the revenue from any sports related medicine within those clinics.
And our clinic is doing well. We see hundreds of patients, and most of them come in 4+ times. That means you're building a long-term relationship with the patients and revenue opportunities for your clinic. We have great reviews. People highlight the one-stop shop and the recovery and prevention models.
So that's it. We are a small startup. We have a couple people right now. We are building our technology, building our operations staff. We're trying to raise about $2.5 million right now at a $12.5 million cap. We have, the use of proceeds is going to be focused on building and coding software process, the operations team, patient provider software applications. So, a mobile app for the patients so they can do their stretches and everything at home, and then marketing and business development.
So our vision is quite simple. We're giving every human access to best-in-class sports medicine. Thank you.
After all, so thank you so much. We've got about 3 minutes left for questions. So do any of our judges want to ask anything?
I'll be quick. Thank you for the presentation. So, for a clinic that is not already focused on sports medicine, and they're adding in some of these services, which, as you alluded to, it can bring in revenues for them, but until they reach a certain critical mass of it, it will kind of be an interruption or distraction to their business, right? Can you speak a little bit to that, and what sorts of support what would help somebody scale this quickly that makes it worth it, as a service line rather than as a distraction?
Well, the doctors are already treating their patients, right? So normally when they would come in, if somebody has a musculoskeletal issue, they will refer them out to another practice. So wouldn't they rather want to do it themselves and treat the patient really there on site for them? And with a little bit of training and a very little overhead, because again, we're taking all the operational side from them, they can take that patient and offer them the same level of services without kicking them out the door.
Great presentation. Appreciated that too. You mentioned that you're going to provide in-network care with most major insurance providers. How are you going about doing that? Are you then taking the liability as a provider?
No, we are registering the provider for them on their behalf, but managing the entire billing and coding process for them. So, we have an automated SOAP system, and, to take the notes, work all that. Obviously, we work with the provider, but all the headache of applying everything that they have to do, we will do for them. So essentially, they don't have to do any homework. We do it all, and then they'll be in network after that.
Any other questions?
Can you please provide a few examples of where you think this could be most impactful? Like what kind of problems and treatments could be used for sports medicine in non-sports offices?
Sure. Like I said, I'm an internist as well. I also work in an urgent care setting as well. So I mean, at least half of my patients have some sort of complaint: neck pain, shoulder pain, knee, hip, foot and ankle. And when you're at your primary care office, let's say you're at your annual visit, often that's an aside at the end, and that's why it just gets kicked out to someone else. It doesn't have to be that way, and it doesn't have to take extra time if you have this model. And it does include maybe having someone in your office that's going to help you work with those patients. And I use athletic trainers and physical therapists. They can be part of your team. So it's not as if you have to be teaching the patients all the exercises. And then the digital part will create an atmosphere where they can go and do those things on their own in between visits, but they're not waiting for months to get into physical therapy.
Thank you guys both so much. If there are any